What are the risks of hip replacement infection or dislocation? Imagine waking up after a hip replacement and wondering what could go wrong. While the surgery can greatly improve quality of life, understanding the risks helps you stay prepared. Infection is one of the main concerns after a total hip replacement. The chance of getting an infection after the initial surgery is about 1 to 2%. If you need a revision surgery to fix or replace the implant, the risk rises to around 4 to 5%. Infections can happen soon after surgery or even years later, making them a serious concern. Several factors can increase the chance of infection. Longer surgeries, pre-existing health issues like diabetes or obesity, or previous infections near the hip area all play a role. If you have an active infection elsewhere in your body, it is important to treat that first before having the surgery. Symptoms of infection include persistent pain, swelling, warmth, redness, or drainage from the surgical site. Sometimes, fever or chills can also be signs. Most infections do not respond well to antibiotics alone and often need surgical intervention. This might involve cleaning out the infected tissue or replacing the implant entirely. Infections can lead to serious complications, including disability or even increased risk of death. Studies show that patients with infections after hip replacement have a higher chance of dying within 10 years compared to those without infections. Preventing infection involves thorough preoperative screening, controlling medical conditions, and using sterile surgical techniques. If signs of infection appear after surgery, prompt treatment is essential. Dislocation is another common issue, especially in the early weeks after surgery. It happens when the artificial ball slips out of the socket. Factors that increase dislocation risk include how the surgery was performed, how well the implant was positioned, and how active you are. Weak muscles or altered joint mechanics from osteoarthritis can also make dislocation more likely. Certain movements, like bending too far forward or twisting the hip, can cause dislocation. That is why careful surgical planning and patient education are so important. Physical therapy helps strengthen muscles around the joint, reducing the chance of dislocation. Managing health issues like obesity and diabetes before surgery can lower infection risk. Following your doctor's postoperative instructions, including wound care and activity limits, is key. If you notice symptoms like sudden pain, a feeling that your hip is unstable, or unusual swelling, contact your healthcare provider immediately. In the end, being aware of these risks and how to prevent them helps you enjoy the benefits of a hip replacement with fewer worries. Proper care, early recognition of problems, and good communication with your medical team are your best tools for a successful recovery.